Let me ask you something uncomfortable. If your doctor looked you straight in the eyes right now and said, based on your biology, here is the most likely way your body will start to break down after 60, would you want to know? Most people say yes. And then they spend the next decade ignoring exactly that information. A study from Harvard Medical School tracked more than 89,000 people over 20 consecutive weeks and found that your blood type leaves a clear fingerprint on how your cardiovascular system ages, how your brain holds up under pressure, and how your immune system responds when it is under attack. Not in the way diet books talk about it, not in the way wellness influencers talk about it, but in the way real medical data collected on hundreds of thousands of patients actually shows. And here is what has kept me up at night after all these years working in preventive medicine. This piece of information, you have had it since the day you were born. It sits on a piece of paper in some drawer somewhere or on a hospital form from 30 years ago, and almost nobody uses it to protect themselves. Today, we are going to walk through every blood type O, A, B, and AB. For each one, I'm going to tell you something most doctors have never once brought up in a routine 15-minute checkup. Not because they are hiding anything, but simply because there is never enough time in that appointment to connect these dots for you. I am going to do that right now. And stay with me through the end of this video because there is one final factor that most people have never thought about, and it can completely change the picture of your health. Blood type O, strong heart, vulnerable stomach. Let us start with blood type O, and I want to frame this in a way you have probably never heard before. Type O is the most common blood type on this planet, making up roughly 45% of the population, and for most of human history, that was an enormous survival advantage. Type O appeared earliest in our ancestral populations, shaped by environments that demanded high physical endurance, a strong immune system to fight off parasites, and a digestive system capable of processing large amounts of animal protein under harsh conditions. So what does that ancient blueprint look like inside a modern body after 60? On the cardiovascular side, type O individuals tend to circulate lower levels of a clotting protein called von Willebrand factor. Less clotting activity means smoother blood flow, less sticky platelets, and a statistically lower risk of arterial blockages that lead to heart attacks or ischemic stroke. That is genuinely good news, and it is significant. But here's what nobody tells type O people over 50. That cardiovascular advantage can become a dangerous psychological trap. I have seen this pattern repeat itself more times than I can count. A type O patient in their late 50s comes in for a checkup. Blood pressure is fine, cholesterol is acceptable, no family history of heart disease. And because they feel structurally protected, they stop paying attention to the systems that are quietly eroding on the inside. They brush off fatigue. They dismiss digestive complaints. They push through joint pain because the most serious age-related vulnerabilities in type O do not come from the heart. They come from below it. The stomach lining of a type O individual has surface receptors that the bacterium Helicobacter pylori, also known as H. pylori, finds easier to attach to than any other blood type. H. pylori is not dramatic. It does not announce itself with intense pain in most people. It moves in silently, colonizes the stomach lining, and over time gradually breaks down the protective layer of the stomach. Left undetected, this creates a slow escalation from chronic gastritis to peptic ulcers, and in a meaningful percentage of cases, to stomach cancer. And stomach cancer caught late is one of the most difficult cancers to treat successfully. So if you are type O and you are over 55 and you have never been tested for H. pylori, that is the single most important conversation to have with your doctor this year. It is a simple test, either through a stool sample or a breath test. It is inexpensive, and for type O individuals, this is not routine caution. This is targeted prevention based on your specific biology. Here is the protocol for type O longevity. Your stomach is your most vulnerable point, so protect it actively and consistently. That means limiting long-term use of non-steroidal anti-inflammatory drugs like ibuprofen and aspirin unless medically necessary. These drugs erode the stomach lining in everyone, and in type O individuals, they land on tissue that is already operating at a higher biological risk. Bring fermented foods into your regular eating routine. Kefir, miso, kimchi, naturally fermented pickles. These are not trendy extras. For type O, they are a practical tool for maintaining a gastric environment that is more resistant to bacterial colonization. And physically, your body was built to move. Type O blood is associated with higher baseline catecholamine activity, meaning your nervous system runs on more dopamine and norepinephrine than other blood types. When that energy has no physical outlet, it converts into restlessness, disrupted sleep, and over time, cortisol dysregulation. 30 minutes of walking every day and 2 resistance training sessions per week will do more for your long-term metabolic health than any supplement stack out there. Type O, cardiovascular strength is your inheritance, your stomach is your responsibility, and do not let the first one make you complacent about the second. Blood type A, strong immune system, heart threatened by stress. Type A, and I want you to lean in here because this is the blood type where the gap between what people know and what they should know is the widest. Type A emerged as human populations shifted toward agricultural living, denser settlements, more complex social environments, and exposure to a wider range of infectious agents. The immune system adapted accordingly. Type A individuals mount strong and effective immune responses, particularly against viral pathogens. In younger years, that is a genuine biological asset. But here is where the blood type story gets complicated, because what protects you in your 30s and 40s begins to work against you in different ways by the time you reach 60. Type A blood carries higher coagulation activity. The platelets are stickier, the clotting proteins are more active. A large-scale study led by Harvard Medical School, tracking 89,500 adults, found that type A individuals carry a 5% elevated risk of coronary heart disease compared to type O. That number sounds modest in isolation, but here is what makes it clinically significant for type A specifically. When you layer chronically elevated cortisol on top of that sticky platelet activity, the compounding effect over decades is what turns a 5% statistical difference into an actual cardiovascular event. Now, here is the layer that most discussions miss entirely. The reason that risk is so significant is not just mechanical, it is hormonal. Type A individuals maintain the highest baseline cortisol levels of any blood type. Cortisol is your primary stress hormone, and in short bursts, it is useful. It sharpens focus, mobilizes glucose, prepares the body to handle a challenge. But when cortisol runs chronically elevated week after week, month after month, it does something very specific to your arterial health. It inflames and stiffens the endothelium, which is the thin inner lining of your blood vessels. And here is the mechanism that every type A person over 55 needs to understand clearly. When your endothelium is inflamed and less elastic, it becomes a surface that sticky platelets preferentially adhere to. The elevated clotting activity of type A blood and the chronic cortisol-driven endothelial inflammation of type A physiology are not two separate risk factors. They are a compounding cycle where each one makes the other more dangerous. What this means practically for type A is that stress management is not a wellness preference. It is direct cardiovascular medicine. It belongs in the same category as blood pressure medication and cholesterol management because physiologically it is addressing the same underlying pathway. If you are type A and over 55, getting your blood pressure checked every 6 months instead of annually is not overcautious. It is appropriate clinical monitoring for your specific biology. Ask your doctor to include homocysteine in your next blood panel. This is an amino acid that, when elevated, actively damages arterial walls. Type A individuals trend toward higher homocysteine levels, and the intervention is remarkably straightforward. Adequate folate, B12, and B6 found in dark leafy greens, eggs, legumes, and lean proteins. And build a daily cortisol reset practice. Not a weekend retreat, not an occasional meditation session, but something you do every single morning before the day gets its hands on you. Diaphragmatic breathing, 4 seconds in and 6 seconds out, practiced consistently for 10 minutes, has measurable effects on cortisol regulation in clinical studies. Consistency matters far more than duration. 5 minutes every morning outperforms an hour on Sunday by a significant margin. Type A, powerful immune resilience is your asset, and cardiovascular risk driven by a stress hormone that your blood type keeps chronically elevated is what you need to actively address. That is the most important health decision you will make this decade. Blood type B, the most metabolically adaptable, but immune system can run unchecked. Type B is the blood type that conventional medicine understands the least, and mainstream wellness culture handles the worst. Type B emerged among nomadic populations moving across the vast interior of Central Asia and the Himalayas. These were people constantly adapting to new food environments, new climates, new infectious pressures. The immune system that developed is genuinely remarkable in its metabolic flexibility. Type B individuals can efficiently process a wide variety of proteins, fats, and carbohydrates without the inflammatory friction that other blood types sometimes experience when dietary variety changes. That adaptability is real, but here is the clinical problem that most type B individuals over 55 are carrying around without knowing it. Type B carries a distinct immune signaling profile that is not yet fully understood. What research consistently shows is that type B individuals have a measurably different gut microbiome composition, and certain dietary inflammatory triggers, specifically refined seed oils, ultra-processed foods, and high fructose corn syrup, appear to generate stronger systemic inflammatory responses in type B compared to other blood types. This kind of low-grade, smoldering immune activation can run below the surface for years and gradually distort immune precision. A study conducted by the Johns Hopkins Bloomberg School of Public Health over 8 months, tracking more than 6,200 adults, confirmed that consistently elevated C-reactive protein, a standard inflammatory marker, is strongly associated with increased risk of cardiovascular disease and age-related cognitive decline, particularly in individuals with less diverse gut microbiomes. This means your CRP level, available on a standard blood panel, should be monitored at least once a year if you are type B and over 55. A consistent CRP reading above 1 milligram per liter without an obvious acute infection is a meaningful signal. It means your immune system is running in a chronically activated state, and you need to find the trigger before it finds you. On the food side, the picture is clear for type B. Your flexible immune system needs clean inputs to function properly. Refined seed oils, ultra-processed packaged foods, and fructose in sweetened drinks do not just represent empty nutrition. For type B, research points to these as particularly potent triggers of low-grade systemic inflammation. You do not need to eat perfectly. Simply eliminating most of those specific triggers consistently is already enough to make a noticeable difference. For exercise, type B physiology responds best to sustained, moderate-intensity movement rather than repeated high-intensity bursts. Cycling, swimming, hiking, and consistent walking protect your inflammatory baseline far better than training regimens that generate sharp spikes in inflammatory markers during recovery. Type B, the most metabolically adaptable blood type on the planet. Keep your immune system precisely calibrated, and it is one of your greatest assets. Let it run unchecked, and it becomes one of your most serious vulnerabilities. Blood type AB, superior immune tolerance, brain needs the most active defense. Type AB is the youngest blood type in human history. It appeared relatively recently in evolutionary time when populations carrying type A and type B antigens began mixing at scale. And because of that dual inheritance, it carries a genuinely unusual immunological profile. On one side, type AB inherited the immune tolerance tendencies of both parent types. AB individuals show lower inflammatory responses to certain environmental antigens, which means meaningfully lower risk of some gastrointestinal cancers and certain gastric conditions compared to other blood types. That is a real and significant advantage. But here is where I need you to pay close attention, because what type AB gained in immune tolerance, it carries a cost in neurological vulnerability that the research has made increasingly difficult to ignore. A study conducted by the University of Vermont, tracking more than 30,000 people over several months, found that type AB individuals have an 82% higher chance of developing cognitive decline compared to type O, which carries the lowest risk. That is not a small difference. The mechanism is cerebrovascular. Type AB blood carries elevated clotting factors inherited from its A component, combined with the cardiovascular complexity of the AB antigen profile. Over decades, this creates subtle but cumulative changes in blood flow through the brain's smallest capillaries, the microvessels that serve the regions most responsible for memory consolidation, processing speed, and executive function. These are not dramatic blockages. They are microscopic, gradual changes in perfusion efficiency across neural tissue that most people would never notice until the cumulative effect has been building quietly for 15 or 20 years. This is why, for type AB individuals, cardiovascular health and brain health are not two separate conversations. They are the exact same conversation. Blood pressure control, blood sugar management, cholesterol and triglyceride monitoring, every intervention that protects your arterial health is simultaneously protecting your cognitive longevity. DHA, the long-chain omega-3 fatty acid found in fatty fish like salmon, sardines, and mackerel, is incorporated directly into the cell membranes of neurons. It maintains membrane flexibility and reduces the neuroinflammatory signaling that accelerates small vessel disease. 2 servings of fatty fish per week, each serving around 3.5 ounces, or a high-quality fish oil supplement discussed with your doctor, is not optional supplementation for type AB individuals. It is targeted neuroprotection based on your specific biology. Sleep is the other non-negotiable for type AB. During deep sleep, your brain's lymphatic system, its internal waste clearance network, flushes out accumulated metabolic byproducts, including the amyloid proteins associated with neurodegeneration. Consistently sleeping under 6 hours per night meaningfully impairs this process. For type AB individuals, chronic sleep deprivation is not just fatigue. It is accelerating exactly the biological process that your blood type already makes you more vulnerable to. 7 to 8 hours every night and staying consistent with that. This is your most powerful daily intervention. Type AB, impressive immune tolerance, and a brain that requires deliberate, consistent, long-term defense starting right now, not at 70. The RH factor, positive or negative, and why it actually matters. Before I wrap up, there is one more variable that almost nobody includes in these conversations, and it genuinely matters. That is the plus or minus at the end of your blood type, RH positive or RH negative. About 85% of people are RH positive, meaning they carry the RH antigen on the surface of their red blood cells. The remaining 15% are RH negative, and this difference is not clinically minor. RH negative individuals appear to carry a slightly different cytokine signaling profile, meaning the chemical language your immune system uses to communicate is calibrated differently. Research is still establishing the full clinical significance of this, but what is emerging suggests that RH negative individuals may have heightened sensitivity to certain inflammatory triggers. What this means is that regardless of your primary blood type letter, if you are RH negative and managing any chronic inflammatory condition, the anti-inflammatory protocols I have outlined today are even more relevant to you and should be implemented more rigorously. And here is one important thing to know. Make sure to ask your doctor about your complete blood type, including both the letter and the positive or negative sign, and make sure your doctor has both on record. The most important thing I want to say to you today, and now for the most important thing I am going to say today, and this is the thing that most blood type content completely avoids. The statistics are real. The elevated risk levels are documented. The biological mechanisms are genuinely significant, and they are not your destiny. I have watched type AB patients in their 70s with sharper cognitive function than colleagues 15 years younger. Not because their genetic risk profile was somehow different, but because they understood what their biology was working against, and they built their daily lives around addressing it. They slept 8 hours. They ate 2 servings of fatty fish every week. They maintained their blood pressure below 120/80 consistently, not just when they remembered. They kept learning genuinely new and challenging things, not casual scrolling, but real cognitive engagement. Their risk was still there. The statistical profile still applied to them. They simply chose to meet it directly rather than let it accumulate quietly in the background. The gap between genetic predisposition and actual health outcome is not small. It is enormous, and it is filled entirely by choices made consistently over the years. That gap is where your decisions live. Your blood type is not a sentence. It is a map. And a map is only useful if you are willing to look at it. We have now walked through all 4 blood types, O, A, B, and AB, along with the RH factor, and I hope you are now looking at that old blood test result in a completely different way. Your body has been sending you signals for years, and now you have the context to understand them better. Do not let this information just sit in your head. Schedule an appointment with your doctor, ask for the tests that are right for your blood type, and start making those small but consistent changes starting today, because you have carried this body a long way and it deserves to be properly taken care of. If this video was helpful, please share it with your family so they can know and take steps to protect their own health as well. Hit the like button so this video can be recommended to more people, and subscribe so we can meet again at the next piece of advice.